On February 27, 2026, RFK Jr. sat down with Joe Rogan and said something that got the attention of every physician, compounding pharmacy, and patient who's ever asked about peptide therapy. He announced that the FDA is about to make roughly 14 peptides significantly more accessible. An official announcement is expected any day now. So this video is an explainer, and when the announcement drops, you'll already understand exactly what it means. So here's where we start. In the United States, a 503A compounding pharmacy is a state licensed pharmacy that can prepare custom medications for individual patients under a physician's prescription. Compounding exists because not every patient fits a one-size-fits-all commercial drug. Dosing flexibility, alternative delivery routes, ingredient sensitivities, compounding fills those gaps. But not every substance can be compounded. The FDA maintains two lists of what are called bulk drug substances, the raw ingredients that go into compounded medications. Category 1 substances are nominated for use in compounding and are under active review. Category 2 substances are those the FDA has determined present too great a safety risk or are not appropriate for compounding. Category 2 is effectively a ban. In September 2023, the FDA designated 17 peptides as Category 2. That move pulled the legal foundation out from under a significant portion of the peptide therapy industry overnight. Physicians who have been prescribing BPC-157 or TB-500 through licensed compounding pharmacies were suddenly in a very difficult position. RFK called that reclassification illegal. His position is that the FDA moved too fast, didn't follow the required administrative process, and used Category 2 as a shortcut to regulate substances that had no meaningful safety record against them. Many of those peptides never disappeared though. They shifted into a research use only gray zone. Sold online, sometimes imported, often with inconsistent quality control and zero physician oversight. That's the market that exists right now. It's murky, it's unregulated, and it carries real risk that has nothing to do with the peptides themselves and everything to do with the sourcing. So here is a comprehensive list of all the peptides that are currently being reviewed and potentially may be announced that they're moving into Category 1, which means you will start to see physicians and clinics immediately start prescribing these at compounding pharmacies for patients. BPC-157, body protection compound 157, is probably the most widely discussed peptide in this category. It's a synthetic peptide derived from a protein found in gastric juice. Animal studies have shown significant tissue healing effects across tendons, ligaments, muscles, and the gut. Human data is limited to clinical observation studies and case reports, but the safety profile in animal models has been consistently clean. No evidence of carcinogenicity, no organ toxicity at studied doses. So if you've got a tendon injury that's been lingering for months despite PT or gut issues that conventional GI treatment hasn't fully touched, this is a peptide that people were genuinely frustrated to lose access to. It's not a guaranteed fix, and the human data is still limited, but for some people who've run out of conventional options and want to try something with a plausible mechanism, this is one worth asking a physician about. And TB-500 or thiamine beta-4 are also naturally occurring peptides found in virtually every human cell. These play a role in actin regulation, tissue repair, and inflammation modulation. Like BPC-157, it has a strong animal research base and a relatively favorable safety profile with no significant adverse findings in the available data. For athletes and active people dealing with injuries that keep recurring or just won't fully heal, tendons, ligaments, muscle tears, again, this is one that's gotten a lot of attention in recovery circles and is commonly paired with BPC-157. The animal data on tissue repair is strong. Human trials are limited, but the people who've been sidelined for months and haven't gotten where they want to be with conventional rehab tend to have anecdotal evidence saying that this works. Now, it's hard to say without an RCT, but again, this is why if these medicines go into Category 1, you're definitely going to see them prescribed more frequently, and ideally we'll get some randomized controlled trials showing how effective they can be. CJC-1295 is a synthetic analog of growth hormone releasing hormone. It stimulates the pituitary to produce growth hormone rather than introducing exogenous growth hormone directly. It's been combined frequently with Ipamorelin in clinical practice. Phase 1 and 2 human trials were conducted. Safety was acceptable within the expected profile of water retention and transient injection site effects. Ipamorelin, another selective growth hormone secretagogue, stimulates GH release with high specificity and minimal effect on cortisol or prolactin, which sets it apart from older secretagogues. That selectivity is one of the most clinically appealing characteristics. Human studies have been conducted in a post-operative setting with a reasonable safety profile for this peptide as well. So if you're in your 40s or beyond and recovery feels like it's taking twice twice as long as it used to, or you're doing everything right in the gym but muscles are harder to hold on to, this combination is probably one of the most relevant on the list. The goal is support your body's own GH output rather than replacing it. It's a more physiologic approach, and it still needs monitoring from a physician who knows the space, but it's one of the more practical peptides for an actively aging population. AOD 9604 is a fragment of the human growth hormone molecule specifically associated with fat metabolism. This one is particularly notable because the FDA granted it GRAS status, which is generally recognized as safe in the context of food use. That classification doesn't automatically translate to injectable use, but it signals something meaningful about the compound safety assessment. So for anyone who's already dialed in on diet and training but has hit a plateau with fat loss, particularly around stubborn areas, this is one worth knowing about. It's been studied specifically for fat metabolism without the blood sugar and IGF concerns that come with full growth hormone, which is part of why it's appealing. Not a starting point, but a reasonable next conversation with a physician once the basics are covered and if it gets moved into category 1. Thymosin alpha 1 has the most established international track record of anything on this list. It's been approved already and used clinically in over 35 countries for immune modulation in hepatitis B, hepatitis C, and in oncology as an adjunct to chemotherapy. The human data here is the most robust of any peptide on this list. The reason it wasn't already approved for compounding in the US is regulatory and does not appear to be safety-based. If you feel like you're always the person to catch whatever is going around, or like your immune system just never fully resets between illnesses, this may be worth exploring. It's one of the better studied peptides on the list from an immune standpoint, and the people who tend to be more interested are those who feel like they're chronically running below full capacity. Obviously, physician oversight will be required if it goes into category 1, but if you want to have those immune effects, this would be a peptide you may want to consider. Epithalone is a synthetic tetrapeptide studied primarily in Russian research institutions. It's been examined for telomerase activation and potential anti-aging mechanism. The bulk of the research comes from animal and in vitro studies, and human safety data is limited but hasn't raised any red flags in the studies that do exist. So if you're deep into the longevity space and you've already covered the basics, sleep, exercise, nutrition, metabolic optimization, and you want to explore what's at the frontier of aging biology, this is one that definitely will be coming up. The research around telomere length and aging is genuinely interesting, even if the human evidence is currently sparse. This is the kind that is best explored with a physician who knows the literature. However, if you want to really push the limits of peptides, this is definitely an interesting one that you can consider. Cmax is a synthetic analog of ACTH, the adrenocorticotropic hormone. It has been used medically in Russia for decades, primarily for cognitive and neurological applications, stroke recovery, optic nerve damage, and cognitive function. It's been prescribed there as an approved medication. Western clinical data is sparse, but there's a meaningful body of evidence behind it from international use. For anyone dealing with persistent cognitive fog, the kind that doesn't fully resolve with better sleep or less stress, or just wanting sharper focus and mental clarity, this is one that's generated a lot of interest. The literature is primarily from Eastern Europe and animal models, so the evidence in humans is currently limited, but the mechanism is again plausible and the safety profile is generally considered benign. It's definitely worth exploring if you're interested in this area of peptides. Selenk is a synthetic analog of endogenous peptide tufstin studied for anxiolytic and nootropic effects. Like Cmax, it has a history of clinical use in Russia, and the pharmacological profile suggests low toxicity, but large-scale Western RCT data doesn't currently exist. So if you're dealing with anxiety and common practices haven't been helping you, or you don't want to go on an SSRI, then this is a peptide that may come up. It has been studied as an anxiolytic without the dependency profile of some of the traditional medicines. Now, it's not a replacement for proper mental health care and therapies like cognitive behavioral therapy, but for people looking for an alternative avenue to explore, it may be worth discussing. KPV is a tripeptide fragment of alpha melanocyte stimulating hormone. Research interest has focused on its anti-inflammatory properties, particularly in gut inflammation. Early data in animal models of inflammatory bowel disease has been promising, and human clinical data is still in early stage. For anyone living with IBD, Crohn's, or chronic gut inflammation that hasn't reached full remission with conventional treatment, this may be worth knowing about, as the preclinical data on its anti-inflammatory effects in gut tissue is compelling, even if large-scale human trials are still lacking. It's not a replacement for your GI specialist protocol, but it's a conversation you may want to have with them if you are going to go down this avenue anyway. The GHKCU injectable refers to the copper peptide GHKCU, which is now being taken by people right now under research use only in injection format. Now, topical GHKCU is actually already widely used in cosmetic formulations. The injectable form is what's at issue here. Research suggests there's a role in wound healing, tissue remodeling, and anti-inflammatory signaling. However, safety concerns specific to the injectable route remain understudied compared to the topical application at this moment. So this one's a little different from the rest. A lot of interest here is cosmetic. If you're focused on skin quality, reducing the visible effect of aging, or just want that overall glow that tends to fade in your 30s or 40s, this is a peptide that comes up most amongst that conversation. It's also been studied for wound healing in clinical context, and it's worth looking into, especially given the fact that there's already topical formulations for it. MOTS-C is a mitochondrial-derived peptide first identified in 2015. It plays a role in metabolic regulation, involving insulin sensitivity, exercise adaptation, and cellular energy homeostasis. The research is early but mechanistically interesting. It's one of the newest compounds on the list and has the thinnest evidence base accordingly. So if you're someone who thinks about longevity seriously, not just lifespan, but how metabolically healthy you stay as you age, this is one to watch. The research is early and mostly animal-based, but the mechanism is interesting enough that it's getting real attention in serious longevity circles. For people already doing the foundational work who want to explore what's further out on the evidence curve, it's worth a conversation with a physician who follows the research. So Ipamorelin is one of the most clinically established peptides on this list. It's a GHRH analog, the first 29 amino acids of endogenous growth hormone releasing hormone. It was actually FDA approved as a diagnostic agent and used off-label for growth hormone deficiency. It was withdrawn from the market in 2008 for commercial reasons, not necessarily safety reasons, and that history gives it a different evidentiary standing than most of the others. Now, melatonin 2 is the most controversial entry on this list and the least likely to be approved for compounding. It's a synthetic analog of alpha MSH that stimulates melanocortin receptors. It produces tanning, appetite suppression, and sexual arousal as pharmacologic effects. The cardiovascular and melanoma concerns attached to melanotan 2 are real. Nevi darkening, blood pressure changes, nausea at therapeutic doses. So if the FDA draws a line anywhere on the list, my guess is that melatonin 2 is the most probable candidate for exclusion. So that's a full breakdown of all the peptides that are being considered for reclassification. If this happens, you will see a lot of these peptides being prescribed at compounding pharmacy. Now, I don't foresee all the peptides actually being moved to category 1. Even RFK himself admitted that it was about 14 on the total list that they were looking at, and we'll see if even those 14 hold up. Now, the case he essentially was making is that the only thing that's important is safety, not necessarily efficacy, for moving it from category 1 to category 2, which is his case for why it was illegally moved. So if they deem that these medicines are safe, you may see it back on category 1. Does that necessarily mean they're all effective? Not necessarily, but that will mean they're re-entering the world of compounding. And so that's again why it's important to have someone you trust as you're trying to navigate this complex field of peptide therapy. So if you want more evidence-based breakdowns by someone who actually reads the literature, then click subscribe and I'll see you in the next video.